We have the cure. This new miracle drug, OxyContin. You will be the largest sales force in pharmaceutical history. Make your doctors feel special. Take them to expensive dinners. Bribe the receptionist with a mani-pedi. Whatever it takes to win their trust. Your most effective talking point are these magic words.
Less than 1% of people get addicted to OxyContin.
That's not possible.
I can't live like this anymore.
Let's start you on this. Call it a miracle drug. You only take 2 a day.
I think I can make this the biggest drug in the world.
You think maybe that medicine might be just a tad more addictive than you said?
That's not what we're hearing.
Something is happening here. There might be a unique situation brewing.
A pharma company is lying about their medication.
We have to go after the makers of OxyContin.
My patients trusted me. I can't believe how many of them are dead now.
We're going to do everything in our power to make sure justice is served.
We're going to cure the world of its pain.
Reactions that I had to this series. So now, this series is on Hulu. I don't have any affiliation with them or with any of the people that I mentioned in terms of financial whatever, so this is just my unaffiliated reaction. I do think it is worth watching. I think that one of the first questions that popped up in my mind was, wow, was this Dr. Phoenix guy, was he an actual physician? Turns out no, he is a fictional accumulation of stories. The entire Hulu series, Dopesick, is based on a investigative journalist book by a woman named Beth Macy, and this is Dopesick by the same name. And I'll include links below to the Hulu series and to the book if you want to go buy that. I do think it's an interesting story that is worth checking out. The piece by Miss Macy is actually meant to be more facts-based journalism, and the Hulu is a narrative interpretation of that, the Hulu series. So let's kind of go through some of the things that I think are useful truths that come from this that aren't necessarily like a true narrative piece of thing, but just like truths about the opioid concern in general that you might have heard. So, first of all, opioid addiction is absolutely real. Now, lots of people have varying degrees of opinions on how much of a problem it is, how prevalent it is, and I'll actually include below some links to different news articles and stories that think that maybe Dopesick was a little too heavy-handed and maybe overblowing things. And then some that thought Dopesick really did a good job of really kind of hammering home some of the truths that a lot of people are dealing with this. But I'm telling you this as a physician, someone who talks to other physicians. Opioid addiction is absolutely real, and it is absolutely a problem. Whether or not you want to have arguments about how prevalent it is, all I know is there are a lot of people who are struggling with this, and for those who are struggling with this addiction, it is absolutely a real life-threatening and the stigma with substance dependence, substance abuse is, I really want to drive home a very, very true fact. So I firmly believe that the majority of people, and I have no actual statistic for this, but this is just my belief from meeting a bunch of them. I firmly believe that most people who are struggling with an addiction or a dependence to opioids did not start that out of a desire to have fun or recreation. I believe that most people were started by some well-intending, hopefully, physician or provider of other type who has the ability to prescribe these medications, and they just became dependent because it is the nature of the medicine that it creates dependence over time in some people. So I believe that most of them started with legitimate pain needs, and someone thought that this medicine would be useful for them, and it turned out to take over their life at some point. So I want to be clear that I do not think that because someone is dealing with an addiction that they started with some malintent. A lot of these folks are decent folks who started with someone telling them this medicine would help them with the problem they were facing, and it turned out the medicine caused its own problem. Now, having said that, I think it's also important to note that opioid medications it is not like they are useless. There is some indication for use for these medicines in short-term pain, and they can be very, very useful in helping people get through immediate issues, or what we call acute issues, new issues. I think what does seem to be shown in most of the data so far, particularly when you balance it against the risks, that there is a lessened utility when you start dealing with chronic pain. Because as the longer you take this medication, the tendency for dependency and addiction increases, as well as the tolerance to the dose to where it gives you less of an effect than it used to. And that is a dangerous combination where you start needing more and more of a medication that you now require to feel the same way, and that puts you in a bad place. So that is a thing to keep in mind with this, that over time, it starts to not do what it used to do for you. The thing that makes me think about is there's an episode in the story, and if you are a physician, you're a nurse, you're somebody who works in the medical universe, you probably have seen this before. But man, there was a scene where someone was describing their current status on this medication to Dr. Phoenix, and they were saying, "Doc, it's like I'm sleeping all the time. I can't barely stay awake. And the second I manage to wake up, the only thing I want to do is get another pill." And that really kind of hit home, because as I watched that scene in Hulu, and I'm sure a lot of the physicians out there are thinking the same thing, man, I pictured some patients that I have come across, and I remembered patient interactions that I've had, and I remember the struggle that they were facing. And man, that hit real for me. And it was one of those instances where a fictional narrative story can really drive home some real life truths. The other real life